everyone. Welcome to the Nurse Makers YouTube channel. My name is Dr. Niomi Senatus, and I will be going over some NCLEX need to know with you. So first thing first, let me give you a proper introduction about me. Like I said before, my name is Dr. Niomi Senatus. I've been in the nursing field for close to 20 years now. I'm also a nurse practitioner. I've been a nurse practitioner for the last 12 years. I've been a nursing instructor. So my nursing experience, I have a lot of nursing experience basically. And the thing that I love most about nursing is teaching. I love teaching in the clinical setting, and I love teaching in the classroom. I just love, imparting the knowledge that I know on the future generation. And in nursing, we're always learning. Even the old school nurses, there's always something new to learn. And I just love helping others learn. So one of the major components of the NCLEX is obviously management of care. It compromises about 17 to 23% of the NCLEX. So you really want to make sure you're able to succeed in this section. So inside management of care, basically that's an umbrella term. Inside management of care, there's priorities, delegation, ethics. There's so much. Today I decided to go over priorities because that is one of the major things a lot of students tell me they see on the NCLEX. Which patient should they see first? And so we're just going to go ahead and dive into that. So come on in, gather in everyone. So when we're talking about prioritization, when you see the NCLEX or when you're looking at the NCLEX, they like to ask you, what is the most important? Or what should you do first? So those are some key words that you'll probably see when your question is a prioritization question. Okay, so again, which client would the nurse see first? Which nursing intervention is the most important? Which of the following actions should the nurse take initially? And which response is best? Also, another question you may see is, which of the following interventions will be essential? So those are some prioritization questions you may see when you're dealing with the NCLEX. So questions that you should ask yourself when you're prioritizing patient care is this an acute problem or a chronic problem? Okay, acute is always going to take precedence over chronic, because chronic, you've had this for a while, you've been living with this, I'm not too worried. But something that is acute is something that's new. We don't really yet know what it is, or it's so new that it's not stable yet. So that's going to take priority, acute versus chronic. Another one is, what could happen to the patient if you fail to take action right now? So if it's, shock, if the patient is going into shock, and you don't do what you need to do, we know what shock leads to, right? Shock leads to basically death, because in the presence of like hypovolemic shock, you're losing a lot of fluids, you may be hemorrhaging, and so the loss of fluid means, or blood, basically means no perfusion to the tissues. No perfusion to the tissues basically means to ischemia. Ischemia leads to necrosis. Necrosis leads to death. So if your organs die, slowly but surely, you're shutting off and you will die. So what will happen if you don't take action? Also, another question we like to ask is, what can you delay safely to get to something more important done now? Example, a lot of times, especially in the hospital setting, you may have like 4 patients, 6 patients. However, one of those patients may be a patient that is being discharged. Trust and believe that discharged patient is probably the one that's going to be calling you the most, because they want to go home. They've been discharged since 10 o'clock and it's 12 o'clock and you still haven't discharged them. they're going to be calling you. But on NCLEX, that's not what's most important. And of course, in the real world, that's not what's most important. What's most important is probably that unstable patient that needs your attention. And so you need to be able to juggle that and be able to recognize that. Discharge, you're stable, you're going home. I have someone else who's probably coming in with chest pain or shortness of breath, and that person is going to be more important. Also, another thing we like to ask ourselves when we're doing prioritization is, which assessment, diagnostic test, or nursing intervention should take priority for the patient's condition? Okay, if a patient comes in with a stroke, you know automatically this patient needs a CAT scan. Why they need a CAT scan? Because we need to determine what type of stroke they're having. Because there's two types of stroke, right? So if we're thinking ischemic stroke or hemorrhagic stroke, we need to know, because that will tailor how we're going to treat this. So what should the nurse do first? When we're looking at what should the nurse do first, we need to prioritize. Okay? High priority is going to go to those life-threatening issues, okay? ABCs, think ABCs, okay? Respiratory distress, unresponsiveness, chest pain, anaphylaxis, shock, PE, pulmonary embolism, tension pneumothorax. Those are all life-threatening issues. If we don't take care of them right away, they will most definitely lead to death. Then we have medium priority, okay? Those are usually our safety needs. Acute pain. Pain is a problem. People come in, they're in pain. But again, if you're not breathing, that's more important than your pain, right? So airway, breathing, circulation, okay? Schedule medications, mental status change of level of consciousness is also, something that is considered urgent. And then we have low priority. Again, basic comfort, knowledge deficit, family coping, physical mobility. Those are important too, but they take third place basically. Again, airway, breathing, circulation, life-threatening issues. That's what we're going to do first. Priority 1 is going to be critical. Ensure a patent airway. Okay. All right. So again, like I said, we're always going to think about airway, breathing, circulation. That is basically our framework. Focus on your patient's airway. If they can't breathe, if they don't have a patent airway and they can't breathe, that's more important than the circulation. Again, we need you to breathe. We need you to be able to take in oxygen and exchange carbon dioxide. Okay, so airway is going to always take precedence. If their throat is closing up, if they have a foreign object in their throat, that is more important. Okay, if there's an obstruction somewhere, that is more important. Okay, next we move on to breathing. If their respirations are impaired, they have shallow breathing, that is going to be of importance. And then we go into circulation. If they're not getting blood flow to the vital organs, we know again that those organs will shut down. So ABCs, always think ABCs. Then also think urgent versus non-urgent when we're prioritization. When we're doing prioritization, who should I see first on my patient list? What should I do first? Okay, and who can you delegate this to? Physiological will always take precedence over psychosocial. Psychosocial, yes, they're crying. Yes, their safety is of concern. But if they're bleeding, if they're not breathing, again, you need that first. We're going to talk about Maslow's hierarchy of needs, and that physiological is at the bottom. It's what is basic. It is what is most important. Then again, we go to the acute versus chronic. Acute, remember, acute is new. We don't know anything about it. It's a new symptom onset. And chronic is something you've been living with. If you have COPD, okay, you have COPD, you've been living with it, unfortunately. It is troublesome to you. It is. But it is chronic. However, if you have COPD now and it becomes unstable, You have an exacerbation. Now that takes precedence over something that is stable. So you have your acute that we don't know and our chronic that we do know. So we'll go with our acute. But then you have a patient that is stable versus unstable. Both of them can have COPD, but one has exacerbation. You have to pick the one that has exacerbation because that's not their normal. Okay? Then we have predictable versus unpredictable. Certain diagnoses, we know what to predict. We know how it plays out. But if it's something else happens or something else comes up, that's unpredictable. That's something we don't know about. And that nurse is going to have to be the person to hold on to that patient. Okay? When we talk about delegation, next time we'll go over that more about who the nurse needs to hold on to and who she needs to delegate to the LPN or the unlicensed assisted personnel. Next, let's talk about Maslow. We must talk about Maslow because Maslow has a hierarchy of needs. Basically, Maslow tells us we have basic needs. Our basic needs is getting oxygen, getting food, and toileting, elimination. So those are our basic needs, and those take precedence over everything else. If you're not breathing, you're not alive. So ABCs are part of our basic needs. Okay. Also, we have security, safety and security, especially with our psych patients. A lot of them, their mental mindset is not stable. So safety will be the next thing. But first, physiological. Physiological, okay, that is basic. We all need food. We all need water. If we don't have food, we won't live. If we don't have water, we won't live. If we don't have air, if we're not breathing air, if we're not getting blood circulating in our body, we won't live. So all of those are our basic needs, okay? So basic needs first. Then we have the safety. We need shelter, okay? We need our patients to be on fall risk, okay? We need patient education. We need all of those seat belts, helmets. Those are part of safety. Safety and security is the next step, okay? So that would be your second thing. Third is love and belonging, okay? We want them to have a nice relationship, okay? Everyone wants to feel loved and everyone wants to feel belonging. But still, you need to be alive first before you can have love and belonging. Fourthly, we have self-esteem, okay? So self-esteem, basically feeling empowered, feeling that you met some personal achievements, accepting your appearance, body habits. That's basically self-esteem, okay? And then we have the last top of the pyramid, which everyone, I hope everyone reaches this, and that is basically self-actualization. Basically, spiritual well-being, enhanced growth, hope, just being where we all want to be, the top of the pyramid, okay? But before we can get to the top of the pyramid, we need to stop from the bottom, okay? And again, that's what takes precedence. Breathing takes precedence over self-actualization, over loving, belonging. You need to breathe first before you can do all of those other tasks that we talked about. Okay. So the next thing we want to talk about when we're talking about prioritization is the nursing process. You know, us nurses, when you were in school in fundamentals, they told you about the nursing process. So there's 5 steps in the nursing process. And when I was in nursing school 20 years ago, we learned a delicious pie. It's still a delicious pie. So the A stands for assessment, the D stands for diagnosis, the P stands for planning, the I evaluation, the I implementation, and the E evaluation. All right, so let's talk about assessment. Assessment can be broken down into subjective and objective. Subjective is basically what the patient tells you. The patient tells you they're having this going on. The patient tells you they have that going on. You don't see it. It's subjective. It's what the patient tells you. Objective, though, objective is what you can see and it's measurable. It's their blood pressure, okay? It's their vital signs. It's their labs. It's data, okay? So objective is measurable. Also, I want you to remember, pain is subjective, and pain is whatever the patient tells you it is. It is a vital sign as well, okay? D goes into our NANDA, our nursing diagnosis, okay? So after we do our assessment, right, we go and we evaluate our patients, we do our assessment. It could be a head-to-toe assessment or a focus assessment. Based on our assessment, we go with a diagnosis, okay? So a NANDA approved nursing diagnosis is what we do next. Based on our diagnosis, maybe it may be impaired skin integrity. Based on our diagnosis, we will have to plan. What will we plan about impaired skin integrity? Okay. Our interventions, what are they going to do? What are they going to be? All right. So the next letter in our nursing process is the letter P, where we are planning what we're going to do. And we can talk about skin turgor or skin breakdown, but when I like to talk about planning, I like to talk about weight loss, because I think a lot of people have goals in regards to weight loss. So your goal needs to be a SMART goal. It needs to be specific, meaning I'm going to do this within this time frame, okay? Example, I'm going to lose 10 pounds by next month. That is specific, and I gave you a time and I gave you a measurable goal, okay? So SMART goal, it's specific. That's what the S stands for in SMART. It's measurable, okay? It is achievable. Can you achieve it? Yes, of course. It is realistic. Now, if I said I was going to lose 100 pounds by next month, that's not realistic, right? That's not achievable. So it needs to be achievable. It needs to be realistic. And then timely. That's what the T stands for. It needs to be within a specific time period. Maybe somebody can lose 100 pounds in a year, but not in a month, okay? So we want to do SMART goals. And our next thing is implementation. How are we going to do this? What are we going to do to make us reach those goals? Exercise, watch what you eat, stay hydrated, drink fluids, cut down on soda. Implementation is basically what are you going to do? And in nursing, when I go back to that skin breakdown, maybe we'll say turn the patient every 2 hours, use barrier cream, have the patient sit down sometimes, not stay in one position. And we can implement that to our team. We can implement that to the CNA. We can implement that to the UAP. We can implement that to our LPN or LVN. Okay? It doesn't only have to be us that is doing it. You can delegate, which, like I said, next video we'll talk about delegation. And the last thing is evaluation. We need to be able to go back and look at, did we meet our goal? Did we set out to do what we said we were going to do? Right? So, in a nutshell, when we are talking about prioritization, we need to think about ABCs, Maslow's hierarchy of needs, and the nursing process. These 3 things will help you master NCLEX prioritization. All right, everyone. So do me a big favor. Don't forget to subscribe. Hit the notification bell so you'll get my new video. And I'll be, more than happy to give you all more NCLEX tips so you all can be successful, so you all can be the next generation, so you all can be the nurses that I know you want to be. So this is me signing off. See you next time. Bye.